There is a hidden side effect of Ozempic that the pharmaceutical industry will never put on a billboard. It does not show up in the commercials. It does not appear in the slick before and after photos. It is happening to a measurable percentage of users, and they are starting to talk. The condition has a name now. The internet is calling it Ozempic breath. And the underlying mechanism is a window into what these drugs are actually doing inside your body. Today, the truth about Ozempic breath, the 7 warning signs that signal it has started, and the question almost no one is asking about long-term metabolic damage. The number 1 sign is the one users notice last. Welcome back to Inflammation Nation. Today we are exposing the hidden side effects of GLP-1 drugs: Ozempic, Wegovy, Mounjaro, Zepbound. These drugs work by mimicking a gut hormone called GLP-1, which slows gastric emptying, suppresses appetite, and reduces blood sugar spikes. The weight loss is dramatic. The side effect profile is far more complicated than the marketing suggests. A 2024 review in the journal Pharmacotherapy found that gastrointestinal side effects affected nearly 70% of users, and the long-term consequences of dramatically slowed gut motility and ketosis-adjacent fat breakdown are only now being mapped. The breath signal is one window into all of it. Here are the 7 warning signs of Ozempic breath and the metabolic state it represents. Sign 7. A fruity or acetone-like smell to your breath. This is the actual breath signal. It is the same smell produced by ketogenic diets and prolonged fasting. The fruity, sometimes nail polish remover-like odor comes from elevated ketone bodies in the bloodstream, which are exhaled through the lungs. On Ozempic, this smell often appears within the first 2 to 4 weeks of starting the medication, as appetite suppression triggers a sustained low-calorie intake and the body shifts toward fat metabolism. It is the smell of accelerated fat breakdown. Sign 6. Persistent dry mouth despite hydration. GLP-1 drugs slow nearly every aspect of the digestive system, including saliva production. The dryness compounds the breath problem because saliva is the primary buffer that keeps oral bacterial balance stable. When saliva drops, sulfur-producing bacteria flourish, adding a second layer to the breath signature. Sign 5. Nausea and reflux that does not resolve. Slowed gastric emptying means food and stomach acid sit longer in the upper digestive tract. Reflux becomes more frequent. The taste in the back of the mouth becomes more sour. Users often report a metallic or chemical aftertaste that lingers between meals, regardless of what they ate. Sign 4. Significant muscle loss alongside fat loss. This is the side effect the pharmaceutical industry is least comfortable discussing. Multiple body composition studies on GLP-1 users have found that as much as 20 to 40% of the weight lost is lean muscle mass, not fat. Muscle loss accelerates metabolic decline. The lower the lean mass, the lower the basal metabolic rate, and the faster the weight returns when the drug is discontinued. Sign 3. Hair shedding within the first 3 to 6 months. Rapid weight loss of any kind triggers a hair shedding pattern called Telogen effluvium. The body interprets rapid caloric restriction as a survival stress and shifts hair follicles from growing to resting. On Ozempic, the loss often appears around month 3. Users describe finding clumps in the shower. The hair grows back, but the regrowth phase takes 9 to 12 months. Sign 2. Persistent fatigue that no amount of sleep resolves. The chronic caloric deficit combined with shifting hormonal signaling, particularly thyroid hormone conversion, leaves many users in a low energy state that does not respond to rest. Subjects report needing to sit down halfway through grocery shopping. Workouts feel impossibly hard. The body is conserving energy. And now, sign number 1, the silent one. The signal users notice last: gallbladder dysfunction and gallstones. Rapid weight loss is one of the strongest known triggers of gallstone formation. GLP-1 drugs accelerate this risk significantly. A 2023 meta-analysis published in the Journal of the American Medical Association found that GLP-1 users had a more than 2-fold increased incidence of gallbladder disease compared to controls. The first sign is often right upper abdominal discomfort after meals containing fat. Users may dismiss it as digestive adjustment. It is often the gallbladder protesting the metabolic shift. That is 7 warning signs of Ozempic side effects, and the breath itself is the most public window into all of them. None of this is necessarily an argument against the drug. For some patients with severe metabolic disease, GLP-1 drugs are life-changing. But for the millions taking them for cosmetic weight loss, the trade-offs deserve a hearing that the marketing never gives. The pharmaceutical industry profits from incomplete pictures. Your body benefits from complete ones. If this investigation gave you a new framework, subscribe so you do not miss next week. We are going after the silent symptoms of dementia that show up 20 years before diagnosis. Until then, stay curious, stay skeptical. This video is for educational purposes only and is not medical advice. Always consult your healthcare provider about any medication.